Today we will see about how to approach the community health examination. So, if you see all the community health, if you take pediatric, if you study medical surgical, if you study OBG or psychiatry, anything, all are going to base the community based psychiatry, community based pediatric, community based. So, community based care will be helpful to reduce the healthcare cost in our country. So, community health nurse first of all should have a knowledge about pediatric, OBG, psychiatric. This one, the community health nurse should has give the overall idea. So, how you must be knowledgeable, must be confident enough. Community health nurse must have a good communication skill. The communication skill will make you to help the patients, and really they will invite you in your house, and you can give even other advices. The first thing you have to remember for your examination, you have to remember that the bag where you are going to keep. Don't keep the bag on the way or where the children can be reachable. Even you can, the table or something they are offering, you can use it. There is no problem in using the bag. So selection of the area is very much important. And communication, inform them you have come for the examination, and you are going to do the comprehensive care. Your beneficiary is this much, but you are going to give a comprehensive care. The examiner will be always expecting the comprehensive care. Maybe you got a pediatric patient or geriatric patients, you may have a BP apparatus and everything. So you must do all BP checkup to the all of them. If it is they are in above 45, this one you can have a CBG or anything random blood sugar level, you can check it. So communication is very important. Then the bag, we are studying information technology, AI, but what about our community bag? Our community bag, still we are having urine tube, test tubes that can be very well can be removed. That's a really old procedure. Now we have a urine dipstick, so that will be very much helpful. All the values are coming in a one dipstick. You can use this, and also you have a glucometer to check the glucose level. If not there, with this you can even refer every primary healthcare center or nearby within 3 to 4 or kilometer. Also sub-centers also, it's very nearby whichever the village you are selecting. Then the variety of AV8s examiner will be expecting while using. Okay, you don't have, you are using posters or something, any AV8s you must use the pointer. Okay, and cooking demonstration, it's not the thing. You have learned so much about the nutrition, you have learned about it's not a fire free cooking also possible. They are always eating aloo, they are always eating this, so you have to, it should be selection of the cooking demonstration should be in a different way. Okay, it's not the thing in a fire which they are, it should be cheap. The principles you have to remember in community, it should be available. You are all buying oats and giving. Why oats? It's a foreign food. Why cannot you introduce what is available and cheap, and it will be health and implemented to all? You can advise the gooseberry, or it is cheap vegetables which is available. You can make a salad and give, and bajra or green gram, bengal gram, anything that you can. Your examination date is coming nearly 10 days yearly. Why can't you sprout and show them? So we are not coming and seeing you what you are doing, but the knowledge what is you are giving about it. If you nothing is there, at least you want to give malnutrition, you can put a sample of this, and you can make a good health education. Also you can prepare it, and soaked, you can all these almond and all these things, soaked one. If you cannot sprouted also, you can give them. So this is the one you have to remember. The comprehensive care, what is comprehensive care? Comprehensive care in the sense you have to cover the whole family members. Are you understanding? So yeah, for example, one mentally retarded person is in the family, so you can do it. The mental status assessment, what you are doing, You are waiting until the examiner to come and ask you, but the examiner will be coming. You are the 10th person. Surely the examiner will be asking you, you are here for more than 1 hour, what did you do? You are failed to do even a BMI calculation. If a BMI calculation, height and weight measurement and BP, health checkup, nothing you are doing, simply waiting for the examiner to see the show the procedure. That is not a community health nursing examination. Please remember that before the examiner come, you do physical assessment, everything, and you record at least in your diary. You put the date, write it, madam, this is the BP, this is one I have seen. So this shows that you are very active participant in the participating in the community health. To the family is a holistic family care you are giving, rather simply sitting and one girl is carrying the bag, still the examiner coming. That's not the way. Examination not for the examiner. This you have to learn to cover the whole family members in the family. So very well you can avoid, and the soap also you can change to liquid soap, and if and the towel has to be changed every time, 2-3 towels. If you go every day, you are going to community, go wash and put it, or in the place when you are using the towel also, in one side one hand, another side another hand, you put it in the hanger or put it in the outside and you change everything. So these are all the simple tips to approach the examination. And especially the childrens are there, examiner will be asking you about the Gomas classification. You cannot memorize the expected weight formula. It is no harm in it. You make it in one paper and you have it in your hand. And also you can, this is not no need to mug it up. At least you apply it, that formula. Even you educate the family members. Educate the family members about what they are, and simple thing you can educate. They are always using the dal from the kesari dal from the ration shop. So you can tell them this may cause the letharism, how to overcome the letharism. You can tell them that you have to soak the kesari dal for 10 to 15 minutes, and then you can warm water and you can wash it nicely, then you can cook. They can avoid. So the preventive aspect has to be focused. So these children has to be measured for this, and you have to focus on immunization and prevention and promotive health care is very essential. It is not the thing all are good or sick. The community health nurse has to promote and re-insist what they are doing. Okay, 86-year-old lady, you are doing, she cannot even walk, range of motion exercise, she has a severe knee pain. So you have to demonstrate them. At least in the salt is there, you fry the salt and give the hot water application you can give. The diabetic person is there, and you have done all the procedure. You can wait one procedure, like diabetic foot care. You use the available article from their family, the big basin on a warm water, you can put little salt and soak it for their leg for some time, and then you not have the used brush will be there, make them to use it and cut the nail, and you can have one towel and the mirror from the house. It is no harm, you are mobilizing the article from the family. It will motivate the family members, even the nurse is leaving, they can they can imitate you. That's the learning is taken place. So simply checking RBC, CBG, it's finished. No, you have to do some other procedure. And while giving health education, you ask them, what do you know about diabetic? They are the boss in diabetic. They will do Google, they will do everything about it. So what they know, appreciate it, and then you tell them what they do not know. They may not know how to take the diabetic foot care. They do not know that every 6 months they have to go to the doctor and confirm it. They do not know what all the different complications of diabetes. They do not know which is the, they may know some of the fruit, they may not know something. You ask them, if they not answer some particular fruit, you tell them. So the interaction and communication will be improving. 80% communication is very, very important. So there are various procedures there. Don't go for spirit lamp and do this one. So implement the new technologies like glucometer, use it, dipstick, you use it. Even checking a hemoglobin. Anemia is the root cause of the problem for community, for all the problems. IMR, MMR, they found out that anemia is the biggest problem. So we have anemia like a glucometer, then hematocrit machine is also available. Okay, this costly if they are not providing. There is a scale which is available, and a small lancet, not like a needle will be available, where you pick one drop, you can put it in the like a litmus paper, one paper will be there. When you put this one drop, there will be a round blood will be there, the color will be indicating. So there will be a scale, hemoglobin scale will be there. The hemoglobin scale, like you can read 8 gram, 9 gram, 10 gram. It's so cheap. If you see the cost, it will cost around only 2 rupees or 3 rupees if you calculate the whole value of it. So you are doing a screening for anemia, screening for non-communicable diseases, giving nutritional education, and moreover you are creating and doing the referral system. Understand? So this is the role of community health nurse, not simply going and standing and waiting for the examiner. Thank you.